My peers, we've been here since 2 p.m., so we're taking bathroom breaks if we have to quickly. We don't want to stop, so if you see us leave, it may be because we're doing that just for a moment or just to, get our legs stretched. It is exactly 5 p.m. Thank you, Ms. Shea, for your compliance, and Dr. Cashwell for your speedy response. The next item on the agenda is the public forum. This is the time where citizens are invited to address the school board on any matter of concern about the school division. Citizens have signed up in advance, and speakers will be given 2 minutes to address the school board. We will follow the sign-up list, and the board will not hear from speakers who have not signed up in advance. Those who have signed up to speak may not relinquish their spot to someone else. We ask that each speaker come to the microphone and clearly state your name and neighborhood or school affiliation. To assist you in tracking your time, if you notice at the foot of the stage, there's a timekeeping system on the platform. Speakers will have 2 minutes of time to speak. The light will be green as you begin your remarks. The yellow light means you have 1 minute remaining. And we ask that you please stop speaking when the light turns red. The school board is here today to hear from you, the community, and speakers should speak directly to us, the board. Unfortunately, we will not be responding to speakers, but I do want you to know from myself and all of my peers that we do sincerely appreciate your attendance here this afternoon and for providing your input. The first speaker is Carrie Hunter.
Hi, my name is Carrie Hunter, and I live here in Highland Springs, and I'm the spouse of an employee.
Miss.
Oh, sorry.
If you'll just hold for 1 second, we'll get the volume
Okay.
correct so we won't have to have you start again.
We have an email from Timothy Porter.
Ready?
You may continue.
Oh, okay. Hi, my name is Carrie Hunter. I live here in Highland Springs, and I am the spouse of an employee at Freeman High School. In the comments this week, we've heard a lot about folks wanting a choice to return, and the argument is that students who do not want to return will not be forced to, and that those students can continue to learn in a virtual environment. But that particular premise, that it's a choice, that learning doesn't require in-person return for those who choose not to return, that itself is an acknowledgement that in-person return is not necessary at this time. It's merely a desired option at this time. But this optional and unnecessary action would take away the choice of the teachers and staff to mitigate the risks in their own lives. As the spouse of an employee, this also eliminates my choice while pushing all of the risk onto my family and my extended families. And honestly, it's been easy to take the discussion around this personally, to react emotionally, and at the same time, though, I get it. It's really hard. And just as I have deeply felt reasons for my responses to the arguments, other people have deeply felt reasons for making those arguments. For each story, you're going to hear about a child struggling with virtual environment. You're going to hear about a teacher that is terrified for an at-risk family member. For each parent who wants some sense of normalcy for their child, you're going to hear teachers struggling with how to deal with doing virtual and in person, and that simply nothing can be normal right now. So at the end of the day, though, this isn't about how any of us feel or how hard it is for any of us. It's about following best practices, it's about science, and it's about facts. And right now, the data tells us that this is not a safe time to return to in-person learning. Cases in the region have been increasing for 21 days. Outbreaks in the region have been increasing for 29 days. Experts tell us that the holidays and flu season raise extreme risks for outbreaks. I just hope that the board makes the best decision for safety according to science and data, and thank you for your time.
Thank you, Ms. Hunter. Next, April Sullivan.
Short here. I'm April Sullivan. I have a daughter at Deep Run High School in 11th grade. However, I want to address something different. I want to address what happened several weeks ago when someone used a fake name to make a recording of a teacher and sent that recording to all of you and the media. When Ashley Turner, Casey Burton, Candace Pipegrass, and Sarah Dickinson distributed the video, they engaged in smear tactics designed to silence teacher voices. This was a coordinated effort to dismiss the survey responses from staff and embolden their own agendas and humiliate a dedicated teacher who has devoted 16 years of her life to teaching in the Henrico school system. Ashley Turner, who eagerly jumped at the chance to make the video, and I have a screenshot to prove that, said she would like to know what y'all plan to do about this intentional skewing of the survey data. Candace Pipegrass states she was not in the meeting, but through her mind-reading skills, she was able to discern that the purpose of the meeting was to coordinate efforts to keep education virtual, and she is appalled that a group of HCPS teachers would deliberately try to attempt to skew the data and keep children home. Well, I am appalled that you would deliberately attempt to silence teacher voices, and I am angry that you have such little regard for the teachers and staff who have been working diligently to keep teaching our children with limited resources and unwavering dedication. Dr. Cashwell, you let yourself be played by the very same people who make comments on social media calling every single one of you incompetent and that you all need to be voted out. The same group who dismissed Dr. Avula, and I apologize if I'm saying his name wrong, saying, screw that a-hole, he's not even American. The same group where Suzanne Heller, Amy Kenyon, and Ashley Cohen make comments like, how dare I say only one pediatric death in Virginia? And that was a ridiculous, overly emotional response. Unfortunately, children die every day. And they are also part of the same group who, when the parent survey came out, were advocating that the transportation question could be skewed so that people could not use that as an excuse not to go back.
Ms. Sullivan.
The bottom line is emotions are high on all sides of the issue.
Ms. Sullivan, please.
I understand, but I will not stand silent while people with their own agenda use smear tactics against the teachers who are working so hard to make this work for everyone.
Thank you.
I am appalled.
Thank you, Ms. Sullivan. Next, we'll have Sarah Maxwell. Ms. Maxwell.
Thank you. I'm a parent of two HCPS elementary students. I have a neurodiverse child, and he is actually thriving in this virtual setting. He's no longer coming home overstimulated and exhausted by the noises, colors, and amount of people to interact with face-to-face. Virtual learning has actually cut out all these problems. He's able to focus on learning in the comfort of his home with decreased stimulation without having to navigate confusing social situations. Returning to school now, while it is not safe, and taking away the consistency of virtual learning established in the first 9 weeks will be detrimental to students, not only those with disabilities, but those without. Hybrid would be failing our children and would be a death sentence for our children as well, and to teachers. To have the teachers teach in person and virtual at the same time is asking the impossible. Children cannot watch their beloved teachers and friends get sick and die. Children cannot deal with the guilt of bringing the virus home and infecting their family. The trauma of that reality will never go away. Now is the time to keep harnessing creativity to the fullest extent in the virtual setting to meet individual needs, especially moving into fall and winter where positive COVID cases and deaths are on the rise. Please follow CDC guidelines that were released yesterday, and please choose virtual.
Thank you so much. Next, we'll have Sally Ryan Burgess.
Thank you, Dr. Cashwell, members of the board. Tonight, I'd like to talk to you about perception versus reality. The perception that the county is presenting us with is that they are prepared, that in every school the HVAC works up to code and meets ASHRAE standards, that cleaning supplies are in abundance, sufficient plexiglass has been installed, and that every precaution has been taken to keep staff and students safe. That's the perception. The reality is that we teachers work in these buildings every single day. We know the HVAC systems don't work a lot of the time. We know that students will refuse to clean their spaces, that they will take their mask off, share food, touch each other, and exhale into the air. They're kids. They do what kids do. And we should not place the burden of safety on them. We know that plexiglass doesn't stop the spread of aerosols. We know that whether 3 feet or 6 feet apart, bus drivers can't monitor students every moment of a bus ride. We know that many faculty and staff aren't following the rules all the time as it is now. In short, it's all just hygiene theater. We know that the county cannot fully eliminate the risk related to COVID. In fact, the county knows that they can't fully eliminate the risks towards staff and students contracting COVID. You guys use words like feasible, mitigate, limited, reduced. While you can somewhat control the risk, the reality is that risk remains. Would you walk into that situation, a risky situation, with no guarantees of safety for you, your students, your staff, your faculty, your family? I wouldn't.
Thank you, Ms. Burgess. Next, we'll have Liam Sheldon. Liam Sheldon, are you here?
Hello, my name is Liam Sheldon and I go to Hungary Creek Middle School. I really need to go back to school. And every year up to 8th grade, which is this year for me, my final grade on my report card was an A. My worst grade in any marking period was a B. I'm also in all advanced classes and I'm 2 levels above my grade level in math. Does anyone want to guess what my math grade is now? If you guessed A or B, you're wrong. It's an F. It's almost impossible to get good grades in virtual school, especially on quizzes and tests. I find virtual school very frustrating, stressful, and too many hours in front of the screen. I thank you for letting me speak, and I hope that you choose to give students and staff an option to go back in person or stay virtual. And yes, kids can wear masks.
Thank you so much. Scott Sheldon.
Hi, I'm Scott Sheldon. I'm a parent of 2 Hungary Creek Middle School children. This is my first time speaking at an event like this, but I have a couple of observations I'd like to share. First, a rift seems to have developed between teachers and parents that is very bitter and emotional. I've never really seen anything like this. It does not seem to me that there is any real need for this rift when there are options available that could accommodate what most of both parents and teachers are asking for. You have some teachers that would like to return in person and some do not. You have some families that would like to return in person and some do not. This feels more like an opportunity than a problem. Second, I would urge you to not ask teachers to teach classes both virtual and in person. I understand the desire not to disrupt students by switching teachers during the year, but that's a much better option than creating a perpetually bad situation for both teachers and students. Please give everyone a choice. Thank you for your time.
Thank you, sir. Next, Katie Garretts. Ms. Garretts.
Hi, my name is Kate Garretts, and I'm the proud mother of a 7th grader at Tuckahoe Middle and a 9th grader at Freeman. I come here tonight to support, with reservations, the proposal to return to campus 4 days a week. Today, you can make a decision that pleases both sides of the discussion on education amidst the pandemic. Families who want to remain virtual will be able to do so for the foreseeable future. And where feasible and justified, this should also be extended to vulnerable staff members. At the same time, you can honor the request of thousands of families, such as mine, who believe that a timely return to in-school instruction is the right call for our children. I am disappointed with the proposed February return date for middle and high school students, which is 6 weeks shy of 1 year from when they were last on campus. There are no medical reasons to keep them home longer than the elementary level. As a district ranked in the top 20% in the state, Henrico should lead the way in providing the essential service of a classroom education. The $15 million grant from the CARES Act is more than adequate to get students back on campus in a timely, organized, and safe fashion. My youngest daughter is a 7th grader in the Tuckahoe ID program. When in the school facility, she benefited not only from the leadership of her wonderful teachers, but also from being surrounded by a network of motivated peers. Now, one of her virtual classes lets out early to allot class time for students to complete work they didn't turn in. This shows that despite the valiant efforts of both teachers and families in the virtual format, students perform best when they can convene together. My oldest daughter is a freshman at Freeman with an IEP addressing her social skills due to autism. She now has regular bouts of anxiety about being on camera. When assigned to a group project, she was paired mostly with students she has never met before. The virtual environment adds a level of social disconnect on top of the already present challenges she faces. It is not feasible to build optimal relationships through a computer screen.
Thank you so much, madam. Thank you so much.
Thank you.
Next, we'll have Jennifer Farmer. Ms. Farmer.
Thank you for the opportunity to speak today. I'm here to share my experience as a critical care nurse as well as a paramedic that provides care to all age groups in our community. I've been living COVID since February 2020. We started with many unknowns and much fear. Our leadership understood we had fears and concerns, that we had families to keep safe in very high-risk situations ourselves. They did what leaders were supposed to do. They validated our concerns, instituted new protocols and procedures, and did not let politics influence their decisions. They educated us and worked through challenges together with us. Their strong leadership allowed us to continue caring for our patients even in the back of an ambulance, a 6x8 box with limited ventilation, to say the least. What we learned is that it was a mistake to encourage people to postpone care. It was a mistake to limit in-person appointments. It was a mistake to stop allowing visitors, as you can absolutely remain safe with the right protocols. One thing our leadership was 100% clear on is that we had to keep providing patient care. The costs were too great for us not to. We got used to all the new protocols. We've gotten very good at protecting ourselves and our families from COVID. Teaching is essential to the well-being of our future generations. Our teachers need their leaders, you, to rely on data, not politics, to provide education and clear direction. As a medical professional, I see firsthand the rising price our children have of not having the option of in-person education. I see the increase in psychiatric emergency room visits. I see the rising abuse cases, the rising suicide attempts, and successful suicides. I see what it is doing to all families, the children who are slipping through the cracks. Children are dying right now, and I hold their hands. I hold their families' hands. The last school board meeting I attended, a teacher spoke about never wanting to have to attend another funeral. The reality is, you will, and it will not be from COVID, but from abuse, neglect, depression, anxiety, and suicide. If you do not give an in-person option for families and teachers going forward, you too will see the negative impact on our community that I see on a daily basis. I pray for all of you that you don't learn the hard way.
Thank you so much. If you all could do us a favor, I want to alternate mics so that we can properly clean and disinfect the mic. So when the speaker is using this one, could you please go to the next one? What I'm going to do is I'll call 2 names, and then you can get rid of that way. Next is going to be Candy Taylor. Candy Taylor, if you could go to that mic right there, if you don't mind. Thank you, Candy Taylor. And then I'm going to queue up Stephanie Mack. Stephanie Mack, could you be prepared after the mic is clean? Thank you so much. You may continue.
Good afternoon. I wanted to talk today about the fact that we should be thinking about all the people involved in the education process of our children. When you request your child to return in-person learning, you're not risking only your child's health, you're risking the health of other children, teachers, cleaning staff, bus drivers, cafeteria staff, administrators, and families of all these folks. Am I saying that you're being selfish and irresponsible for asking for in-person learning during a pandemic with a virus that is highly transmissible with 1,000 new cases, 85% increase in deaths, a positivity rate rising, and we're located in Henrico County in the top 12 most infectious counties in Virginia? The answer is yes. The lives of children and school employees and many other vulnerable family members are on the line. And we need to think about the long-term effects of this pandemic on the health of our kids and others. The kids are our future, and that will be bright if the correct decisions are made to protect our children now, not the short-sighted risks that you want them to take now because you're selfish and have no vision of the future. Risking one child, teacher, cleaning person, bus driver, cafeteria employee for a small number of people's request for in-person learning is too great a sacrifice. We're a democracy in America, and I expect the county I live in and work for to act as one. The small group rule does not represent the majority of Americans, as evidenced by the current occupants of the White House. This is not acceptable in Henrico County. I see parallels between this situation and what we're experiencing now as a country. The majority of residents in Henrico County have stated the following per the survey results. Across all three models, the majority responded in favor of virtual learning. Are we a democracy in Henrico? I believe we are, based on the foundation of what a democratic society is, which is a form of government where citizens hold the power. The citizens of Henrico have spoken. Majority rules for virtual school. In closing, I say, ask not what you can do for your county, but what your county can do for you to keep families, teachers, cleaning staff, cafe workers, bus drivers, administrations of family and staff safe for a healthy and bright future.
Thank you so much. Next, Mary Carlson, if you could get prepared, queued up on this side. Mary Carlson, if you don't mind. Stephanie Mack, you may begin.
Thank you for the opportunity to speak today. I have a 7th and a 5th grader in the 3-CHOP district. Virtual school isn't working for either of them. They are not okay. I applaud our teachers, our staff. They're outstanding. They're doing the best they can with the circumstances. Many of them are not okay. There are 5 of you elected to make decisions for over 50,000 students and 7,000 teachers and staff. For all the cutting-edge programs, awards, state-accredited schools, Level 1 status, and the $600 million operating budget, Henrico has yet to find a way to safely reopen schools. Many other districts with less resources did. Hanover is one of those. Parents and students I've spoken with there are thriving in mass, in person, and social distancing. You have yet to provide families a choice to do what is best for their children. Families are not okay. Virtual school isn't working for many of us. When the health committee meets next, I encourage you to consider the data from Emily Oster from Brown University on schools and COVID case rates since the pandemic began. Her data covers 200,000 students across 47 states, and the COVID case rate among students is 0.13% and 0.24% among staff. That's a shockingly and wonderfully low number per the Wall Street Journal piece. Have you sat in the homes of families and seen the kids staring at computer screens for hours alone? Did you know the backlit screens they're using cause eye strain in as little as 1 hour of use? This leads to fatigue, headaches, sleep problems. Have you witnessed the frustrations of kids who are constantly clicking through the maze of links, videos, presentations, in whatever format the teacher has put forward, Google, Lexia, Desmos? What about the negative effects of the isolation on children? Please give parents a choice. This county can find a way. There are 40 to 50% of us who want a choice based on your survey. Please return children to school.
Thank you so much. Can I have Laura Santa Cruz on this side? Laura Santa Cruz, queued up, please. Thank you. Mary Carlson.
Hello, my name is Mary Carlson. I'm a parent of a 5th grader in the Tuckahoe District at Carver Elementary. My husband and I have been working. My husband, since March, my husband's actually an essential worker in the grocery business. He works at a grocery store. Our daughter has been attending child care the entire time. We've also even been paying summer rates for child care since March. Our family has tried our best to make this work. I am frustrated just for one. I cannot access student assignments in Schoology. My daughter has struggled to focus, both at daycare and when we took off work to observe her class. While I have appreciated the efforts of her teacher to work with us on catching up with her schoolwork, it has been difficult staying up late at night only to repeat the cycle for the next day. She's been an honor roll student ever since she's been at Carver, and we've been struggling to try to even get close to that. Our family cannot continue doing this. I ask that in supporting an in-person option, whether it's 2, 3, or 4 days, I'm going to leave that up to you, that those who wish for virtual can still also have that option. Unlike some in this audience, I do not want to make a choice for everyone. As a parent advocating for an option for in-person, I understand I hold an even greater obligation to help my daughter's school and teacher. I think any parent here today would be willing to step up. I remember hearing at the last meeting concerns, for example, about art supplies needing to be cleaned. If anybody in here is advocating to come, then we also need to step up and help. So Carver, give me a call, please. I'm also willing to provide my daughter transportation if that becomes a complication with the school. Whatever it takes, the parents need to step up, we will do it. To conclude, I'm asking that we put education and families over politics. I think we can all agree there's enough division already, both here and in the country, and I ask that we support both options. Thank you.
Thank you so much. Can I have Heidi Carlson on that mic next? Heidi Carlson, thank you so much. Thank you so much. Laura Santa Cruz, you may begin.
I'm Laura Santa Cruz, and I live in the Brooklyn district. I followed the school board for years in their redistricting process and was disappointed in the lack of transparency and disregard for community input then. That pales to my disappointment now. I have 4 school-age children who don't even attend HCPS this year, so I don't even have a dog in this fight. But I'm here speaking up for the students that benefit the most from public education, the poorest among us. Private schools are open, daycares are running, pods have been created, tutors are being hired, but when public schools are closed, that affects our most vulnerable population. They are being left behind, and we will soon be seeing an inequality like we've never seen before. Public education is extremely important for the poor, the minorities, the disadvantaged, and we are now operating in almost a segregated system. The term safer at home certainly doesn't apply to everyone. Teachers have always been the #1 safety net for detecting cases of child and sexual abuse. It was mentioned at the school board meeting over the summer that you couldn't lay your head on your pillow at night if a child should die. But how well are you sleeping knowing that every 1 month of school being out, over 100,000 cases of child abuse are going unreported across the country, and Henrico has been closed for over 7 months? If I had time, I would discuss the rise of teen pregnancy, teen overdose, teen suicide, but not one child, right? The data that has been used to close schools are influenced by factors that have absolutely nothing to do with the students themselves. You policymakers are saying the kids need to stay home because they might make us sick. We all know it's not to protect the kids because our leading regional expert, Dr. Abula, has said the health risk is minimal. Statistically speaking, there is more of a risk of us dying driving here today than from COVID. So hugging grandma is not really any more dangerous than driving rush hour, but keeping kids from learning face to face will lead to a generation of adults with long-lasting damage to their economic prosperity, economic justice, and mental health. And these are the very real and very damaging consequences our society will face if schools are not reopened.
Thank you so much. Andrew Thompson, is Andrew Thompson here? If so, would you please, thank you so much. Heidi Carlson.
Hello, my name is Heidi Carlson. I am in the 5th grade at the Carver Elementary. I'm here today to ask you consider giving us the option to return to school. Learning this way isn't working for me. It is very hard for me to focus on the screen so much. I get easily distracted even more now. Sometimes when I am at daycare, it can get very loud because other kids are also listening to their class. I feel I can learn more at school because I can do activities with what I am learning. It's easier for me to pay attention. I'm also not tempted to leave the computer to play. I can be shy. It's hard for me to ask for help. I feel like I am interrupting on the computer. All the kids can type into chat. It's not the same as one person at a time raising their hand. I understand it will be different coming back. I already have to wear a mask at daycare and get my temperature checked. I know I can't sit near my friends. I will follow the rules given to return to school. I love my school. My teacher is working hard for us. I will also work hard too. I have to help her at school. Thank you very much for your time.
Thank you. Desiree Hopkins, if you could get in place on that mic. Desiree Hopkins, thank you so much. Andrew Thompson.
Thank you for the opportunity to address you this afternoon. My name is Andrew Thompson. I have twins who are seniors at Godwin High School. I also have an older son who graduated from Godwin in 2018 and is currently a junior at Washington Lee University. I served for 2 years as PTA president, and I also served as 2 years as the vice president of the Tuckahoe District on the Henrico County Council of PTAs. In fact, my oldest son has said that the teachers at Godwin prepared him extremely well for college. I've been an advocate for Henrico County Public Schools until now. I feel you are failing the kids by instituting a fully virtual academic setting. One of my twins has been a straight A student all through school. However, he is struggling the first part of this year, a vital period as he begins applying to college. When asked what his biggest struggle has been, he says he just can't learn the same virtually. I ask any of you if you think you could learn AP Calculus virtually. The debate on in-person learning versus virtual is fierce. However, I feel that we are driven by fear. Just this week, as mentioned earlier, an article in the Wall Street Journal hit on a couple things. Schools are not super spreaders. We only need to look at Hanover, Colonial Heights, and the others that have returned to the classroom. And as we know, Chesterfield and Goochland are going back. But the Wall Street Journal stats showed that for students, positivity rate for COVID, 0.13%. For staff, 0.24%. McKinsey & Company also released a report that estimates that not having in-person learning through January of 2021 would result in a loss of $61,000 to $82,000 in lifetime earnings for the average K through 12 student. This has a much more drastic impact on lower income households and a correlation to shorter lifespans, as these individuals are not able to afford healthier foods then, preventive health care, and safer automobiles. Not to mention the mental aspect that this is affecting our children. On a side note, I'm concerned over what I perceive to be a lack of transparency amongst the administration of Henrico County Public Schools. Private meetings have been held by the administration with the Henrico Education Association, yet local parent groups are not able to get such a meeting. That's not a way to gain trust from us taxpayers.
Thank you, Mr. Thompson. Caitlin Corby. Caitlin Corby, if you could position yourself there, that'd be so great. Thank you so much. Desiree Hopkins.
My name is Desiree Hopkins. I'm a librarian at Moody Middle School. I have a daughter at Pocahontas and a son at Godwin. Since the school board last met in July, there have been over 25 COVID cases in Henrico schools. 50 more people in this county have died, 4 just this past week, and over 78,000 more have died in the U.S. We are in a worse place than we were in the summer. Now is not the time. What HCPS can offer virtually at this time is much more developmentally appropriate than what we can offer in the classrooms for many of our students. At the last school board meeting, the school board stated that it prioritizes health and safety. I hope this is still true. COVID is worse, and giving schools hand sanitizer, plexiglass, and each classroom one package of disinfectant wipes just gives the illusion of safety. Now is not the time. Mrs. Shea said something at the last vote that resonated with me about her daughter being bright and vibrant and how sitting at the desk all day would dim her personality and love of learning. That is exactly what is going to happen to our teachers when they are forced back into the classrooms. All their enthusiasm and joy of teaching will be squashed. Their choice was risk your life teaching or quit and lose the job you love. In July, Mrs. Atkins said, at Henrico County Schools, we put health and safety first. You can't prevent somebody from being COVID positive. You probably can't prevent someone from dying. But what we can prevent is knowing that we did everything we could do to save a life, and that's the difference. I want to know, are you still going to make that difference today?
Thank you so much. Brent Corby.
Hi, I'm Caitlin Corby, and I'm a new 6th grader at Tuckahoe Middle School this year. I'm going to talk about the positives and negatives of virtual school. I've asked many of my friends what they thought of virtual school. They all said that it's awful. Here's why. I am on a computer for 6 hours a day and expected to be on my computer for another hour after school doing homework and extra help sessions. I'm a hands-on learner and perform better in person than over a computer. My teachers are great though. For instance, I went from hating math to loving math because of my teacher. Think about how much better it would be if we were back in real school, in person. I will leave you with this thought. The only positive of virtual school is the teachers can meet us. Thank you for your time.
Thank you. Mr. Jimmy Lincoln, if you could take your spot there, sir. Jimmy Lincoln. Yes, sir.
Yeah, I'm Brent Corby. I'm the father of the young lady that just spoke, probably better than I'm going to do because I'm not reading. But I think kids should be back in school. And there's a couple reasons. I don't think any of you have been honest with us. Because Amy Cashwell, on the first survey, spoke to the news and said her recommendation was going to be for all virtual schools before anybody had time to respond to the survey. The second survey we got sent out had all these options, but then when we get the responses, then you get the details on each option, which I find not very truthful, okay? Secondly, I don't get any emails, any phone calls. I don't want to have to find out what my daughter's school life is going to be about through social media. It's not professional media. This is a professional setting. Social media is not professional. When you guys announce things, you should send it to the parents. Hanover's been back in school. Every single private school in Henrico County has been back in school. My neighborhood backs up to U of R. They're back in school. If everybody's worried about safety, even the people that are here saying that they're worried about safety, I'm assuming that you have safety protocols in place, right? When they go back to school, the same as you do right here. They're not worried about coming here to complain about their kids going back to school. So, on your survey, it said, if you don't want to send your kids back to school, there will be a virtual option. Everything is about personal choice. So if I want to send my kid to school, I want to send my kid to school. If this gentleman here wants to leave his kid home, he has that right too. At least that's what you said to us. So give us the option. 5 days a week. Anything else doesn't make sense.
Thank you so much. Noel Basma, if I said that incorrect, please forgive me. If you could go into that mic, that'd be so great. Thank you. Jimmy Lincoln.
So I need two things to be established. First of all, it was a laundry day. Y'all know I'm bleeding red, so I don't want anybody watching this on camera to get confused. Secondly, Chairman Cooper, can I please have the same graciousness that you extended to Ms. Shea? Because y'all know I'm a little loquacious and I've got a lot to say. You all have an opportunity tonight, all 5 of you, to remind us about who we are as a county. Because of that opportunity you have, I'm confident that each of you will vote to continue a predominantly virtual model for all grade levels for the remainder of the first semester. Tonight's vote is your chance to reaffirm what Henrico County stands for. I trust you will do what's right because of who we are and what we value. We value our teachers, some of the best in the state, if not the entire county. When they tell us over and over that face-to-face learning will be dangerous, will include as much screen time, and will be less effective than our current model, we listen. We value pedagogy and doing what's best for our students. We are painfully aware that any plan for face-to-face instruction in the midst of a global pandemic will be detrimental to the educational and social emotional development of our young people. We believe in science and empirical data. We don't ignore the advice of medical experts or epidemiologists. We don't avoid hard truths or twist CDC recommendations to fit a preconceived desire. We cherish equity. We don't allow the most privileged among us to claim to suddenly pretend to care about our poorest communities. We understand that asking Black and Hispanic brothers and sisters to return to face-to-face instruction in the midst of a pandemic that is twice as likely to kill them as their white peers is simply inhumane. We practice meaningful leadership that relies on common sense and wisdom gained from experience. We believe prudence should outweigh bureaucratic momentum or oversimplified notions of individual choice. We know better than to be distracted by false narratives or budgetary line items. We are mindful of the fact that our schools exist as part of a larger community. We have a responsibility to our students and our community.
Thank you, sir.
We need to choose futures over funding.
Yes, sir. Thank you. Thank you. Dana Franson, thank you so much. You may begin.
Good evening. My name is Noelle Basma. I'm a teacher at Highland Springs High School, and I have a still straight A student at QMS. He is thriving with virtual learning. I have listened as a parent and as a teacher objectively to many of the concerns presented since March. Parents are concerned that increased screen time and virtual learning have negatively impacted their child's mental health. I ask you, how will you feel when, not the if, but when your child loses their teacher, their friend, their sibling, their parent, to a virus we could have prevented them from encountering in the first place? Even in a virtual setting, I have many students that are concerned about COVID and their families, and they have had to navigate potential exposures at home already. They are worried, they are scared. Let's not compound the damage by returning them to an environment inferior to the setting they're in now and expect them to cope. I care and I love our students. I care about them tremendously. There are days that I spend more time with your children than my own. I do not think we are adequately prepared to keep them safe at this time. Before transitioning to teaching, I spent 15 years in healthcare. I wore PPE every single day. PPE has limits. It has to be worn correctly. It has to be worn, period. Half of you are taking it off right now in this room to drink your beverage. Despite statewide mask mandates, we see parents, we see board members, we see employees taking their mask off and wearing them incorrectly. What's going to make our children comply? Referrals, suspensions? That's the exact opposite of what we're trying to accomplish. Never in my career in healthcare was I asked to use plexiglass as a substitute or supplement to prevent disease transmission. It's a facade, it's an illusion. It provides false comfort against an aerosolized virus. As a current science teacher, I implore you to consider virtual learning for our second quarter for everyone. The curriculum I was hired to follow requires me to teach our students to use reliable sources, make claims based on evidence and sound reasoning, and analyze data objectively. What you're doing with this survey is conducting customer service. Your curriculum is based on science. That is our safest option.
Jessica Orzwowski. Jessica Orzwowski.
She actually had to leave.
Okay, thank you so much. Paige Ratcliffe. Paige Ratcliffe. Paige Ratcliffe. Sarah Johnson. Thank you, Ms. Johnson. You may begin.
My name is Dana Franson. I teach AP Human Geography and Government at Hermitage High School. And you all have heard from me this week. I got quoted in the paper today for what I said on Tuesday. I will get emotional again. I love my job. I'm a career switcher. I've been teaching for 8 years now. I've been coaching for 8 years. Highland Springs people, you guys own 3 tennis titles because I coached our girls to those titles. So I love what I do. Our only option, parents, we were given the option of returning no matter what or quitting. That's not an option. I'm a single teacher. I need my job and I love my job. This is not my job, this is my career. I found my calling when I became a teacher. I check on my kids' well-being often. I've asked them, I've told them, they are doing fine. My AP kids, whoever said AP kids aren't learning, my AP kids are. Okay? And I'm teaching them every single day and I am checking on them every single day. Who's going to check on me? Okay? When I get sick, who's going to take care of me? Because my parents in their 70s, they can't do it. Is my cat going to come take care of me? I don't think so. Are you all going to come take care of me? And my biggest thing is that 2 years ago, I sat in a hospital room holding my father's hand after his heart surgeon told me that he almost died. Okay? Because I am being safe and because I am teaching from home, I have dinner with my dad once a month. My mother, who raised me to be this teacher, she is AFib. If my mother gets COVID, she will die. I could give it to my father, he could die. My stepmother has diabetes. I could give it to her and she could die. So what you're asking me by asking me to return is asking me to stay away from my family. I already lost my dad once. What if I lose him during this and I don't get a chance to do something about it? Okay, I got quoted in the paper for being emotional and I'm not going to apologize for that. Okay, my family means everything to me. And for those of you who have lost a parent, I feel for you because the idea that I almost lost mine, I can't go through that again because of this.
Thank you so much. Thank you so much. Brittany Tiller, Brittany Tiller, Brittany Tiller, Susan Scovin. Thank you so much. You may begin.
I'm Sarah Johnson. I'm a pediatric ICU nurse and mother of 3 students in the Tuckahoe District. One of the most important steps when admitting a patient to the ICU is stocking the patient's room with appropriate emergency equipment. We've had critical situations when the room wasn't properly prepared, which created chaotic risk. This, too, is a critical moment. And are we prepared? Are HVAC systems working efficiently? Have we addressed poor ventilation? Do we have enough nurses and substitutes? Are we ready to follow yesterday's new stricter CDC guidelines? We have no testing requirements, inadequate tracing, asymptomatic spread, and just an honor system for reporting. Cases are significantly on the rise, and we're headed into a pandemic trifecta. 1, cold and flu season. 2, holiday indoor gatherings. 3, cold, dry air. Common sense tells us this is bad timing. Common sense tells us our students, and yes, even our very youngest ones, will be spreading this and taking it home. My experience tells us you do not want to be at the bedside of a grieving parent or a child. You do not want to be unprepared. And sometimes timing is everything. As Ms. Atkins so eloquently stated, we want to know that we did everything we could do to save a life, and that's the difference. The virtual path is safer, more consistent during these next critical weeks. A couple years from now, will we look back on ourselves and see a community that fueled chaos and risk? Or will we have coached our dear children and ourselves through disappointment and difficulty, but towards a better outcome?
Thank you so much.
Our children are watching.
Thank you so much. Michelle Kimberlin. Michelle Kimberlin. Michelle Kimberlin. Megan Hyatt. If you could, to the right. Thank you so much. You may begin.
My name is Susan Scovin, and I'm a parent to a 9th grader at Center for the Arts at Henrico High School. Like you know, the beginning of the school year followed a summer that was not usual, and he was starting his freshman year virtually, not what he expected, but we've both been surprised and pleased at the level of effort on the part of teachers and staff to engage kids, while also being understanding of this unusual situation. After working diligently to establish relationships and engage students in what can kindly be described as a challenging format, teachers are now being asked to potentially risk their lives and or their families' lives by teaching in person. I have been told when expressing my concerns about in-person instruction that I have the option to keep my child virtual. Teachers did not get that option. I'm not just advocating for my child and my family, but for this community. How can we ask teachers who are already putting themselves in harm's way in the event of an active shooter to now be on the front line in a health crisis? Henrico High's principal, Karen Castillo-Rose, said that her guiding principles for this year are patience, flexibility, and grace. The need for those things is even more exigent now. As we look forward into the year with flu season upon us, COVID cases are on the rise here and around the world. Flu season is always a difficult time, and this year it will be combined with a potentially fatal virus about which we know so little. Case in point, the CDC just changed guidelines to say that it only has to be 15 minutes within a 24-hour period that would require contact tracing for potential COVID spread. I appreciate all the county's doing to make schools safe, but to put it bluntly, you can't sanitize the air. We have been told that children will be 6 feet apart, but as close as 3 feet apart, wearing masks and possibly cleaning up after themselves. This does not represent a safe environment. The Journal of Science recently reported that children and young adults are far more significant to the spread of the virus, especially within households. Teachers can attempt to control what's in the classroom. What about outside of the classroom? Parents who don't listen to the science, maybe getting together with friends. And with the holidays approaching, you're just asking for a super spreader event.
Thank you so much. Thank you so much.
Just want to say one more thing. The percentages of 0.13% of 200,000 students, that's 260 students.
Thank you.
0.24% of 200,000, that's 480 teachers that could die.
Thank you so much. If we could just try to keep within 2 minutes per, respecting the other speakers, and plus what we've established as the expectations, that would be so helpful. I'm not trying to be disrespectful, but please, let's keep within the time frame that we've established. Next, Katie Martson. Katie Martson. Katie Martson. Kim Spenceria. Thank you so much. You may begin.
My name is Megan Hyatt, and I am a teacher at Gayton Elementary in the Tuckahoe District. I'm a dedicated 10-year teacher who views her students as family. If the decision is to return, I will have to move in order to protect my father from catching this disease. As healthcare 221,000 people in the U.S., one of them being my uncle. I don't even need that. I've already lost my mom to ALS. I don't want to lose both my parents before the age of 35. With the increase of cases over the last 2 weeks and the new CDC guidelines, I'm very concerned. Integrated services students, which I teach, are at a greater risk of contracting COVID, not understanding social distancing, and not wearing a mask. Students in limited in person have not been wearing masks well, and now we're having a full class in the building 4 days a week with no number cap. I want the parents in this room to be completely honest. When was the last time your child sat in a 6-foot box for 6 straight hours? What about you? Right now, kids have asynchronous time. They can work on the floor, at tables, or even, like one of my students, in their baby brother's crib. If they feel so inclined. This will fundamentally change if we go back. Imagine yourself sitting masked in a plexiglass prison. No rugs, toys, flexible seating, shared materials, high fives, sitting at a desk for 6 hours learning via the same technology as now. Is this what we believe education should be? What if this is an opportunity for us? These kids are learning so much independence during this remote learning. They're growing as individuals, strengthening bonds with their families, and we are growing as educators. I continue to learn so much during remote learning, and my students are thriving. I reject the idea that our students are not capable and resilient enough to make this work at this unprecedented time.
Thank you so much. Thank you so much. Kathy Woodard. Kathy Woodard. It's Kathy. Yes, you can. Sure. You may begin.
Hi, I'm Kim Spenceri, and I teach English at Godwin High School. You know, throughout all this discussion, I keep going back to one question. Why do the guidelines for returning to school contradict the guidelines for all the other facets of mitigation for this virus in our lives? And I feel like the only valid answer is that the real salient benefits outweigh the obviously high risk, except that it doesn't. It doesn't outweigh the risks, and I'll tell you why. Students who choose to remain virtual will experience a drastic decrease in the effectiveness of their instruction because the teachers will be wearing masks and forced to split their attention between 2 or 3 monitors on their desks at the same time as dealing with students sitting in front of them. I've spoken with my colleagues that have had to go through this in other counties. I know how hard it is, and I know how their students suffer. Sharing their attention with both mediums will therefore affect losing substantial engagement with both. Students who return to the classroom will find that truly the only change in their instruction is the setting. There will be nothing else different. They will still be on computers the same amount of time. While the benefit with being with their peers must be acknowledged, the instruction will remain totally online, with the teacher sitting behind her desk or his desk in back of plexiglass. Each student will need to be ready at any given time to revert to virtual instruction in case he or she is exposed to a class member or another teacher in one of perhaps 7 other class possibilities. The student will then stay home for 14 days during this quarantine period. For high school students, that may mean losing their work jobs outside or being part of other extracurricular activities that are also part of their social experience. And the teachers themselves may change.
Thank you so much. Thank you so much.
All right, just one thing. I'm an English teacher, not a math teacher. But if 25% of teachers are going to leave, that's 1 in every 4.
Thank you so much.
Thank you.
Brent Halstead, would you be kind to, thank you. Brent Halstead, if Brent Halstead is present. Brent Halstead, thank you. You may begin.
Hi, I'm Kathy Woodard. I'm a mother of a daughter at Deep Run High School, and I'm a teacher 5th grade at Echo Lake Elementary. This Saturday, I had an emergency appendectomy. That was really scary, especially in the time of COVID. But the scariest thing, which is why I'm here today, standing up while I'm still in pain, and this was my first day I was able to actually sit up to teach, is because when I was in the hospital getting an operation, I was safer and had less risk of getting COVID than I will be if I have to sit in a classroom with my students, with all of us with our masks off eating. The CDC knows that it is spread through aerosol. Once those students take their masks off to eat, any germs they have are going to be in the air. You can even put that mask on back after lunch. It's still going to get in because we all know the science shows us that masks are much better at preventing things from leaving than things coming in. And honestly, it is breaking my heart to see parents here and students advocating for us to go back to school. I love my students. I have taught for 20 years. I'm a national board certified teacher. Teaching is my life. And I don't know how you all can look at me in the eye and say that you are wanting to send me into such a risky situation. I also have a daughter at home who has asthma. It is not safe in any way. There is no way for students to eat in a building. And I have even proposed a plan to the administration for a half day where no students would eat in the building. That at least could be something that could be somewhat safer, although I do not feel that it is even worth that risk. As many people have said, being back in the building is going to be just like virtual learning, except for worse.
Thank you so much. Thank you so much.
Thank you.
Thank you. Katie McMahon.
Hi, my name is Brent Halstead. I'm a science teacher with Hermitage High School. I prefer demonstrations to discussion. I believe,
Mr. Halstead, if you could.
that's about 6 feet right here. That's probably 17, right?
Mr. Halstead. Mr. Halstead. Mr. Halstead.
Mr. Halstead to sit with the crew and eat our food.
I don't know, ladies and gentlemen, I thought that was pretty effective myself. But I, like Mr. Halstead, am a psychology
Excuse me
teacher.
1 second, please. Let me just say this. We appreciate the comments, but if we could again respect the expectation of the school board. And you all are employees, those who are speaking, and we respect you and appreciate you, but please don't put us in that kind of position. What I'm referencing is the fact that these gentlemen, these ladies who are here, their goal is to again just help us to maintain the decorum and respect of this place. That's all I'm asking. You can please share everything you want to say, but just respect the decorum of what this represents. Please. Ryan Macta, are you here? Jeffrey Wooden, are you here? If you can get the position, thank you. You may begin.
Hi, everybody. I'm Katie Mcmahon. I'm a social studies teacher over at Hermitage High School. I teach VA US history, and I also teach psychology. I wanted to thank you board members for the opportunity to speak today. I also wanted to take a moment to thank you for making the decision that kept us safe in the first 9 weeks. I myself am a type 1 diabetic, and I'm sure I would have been infected and quite possibly have died
for going back that soon. But appreciative as I am, those aren't the only thoughts I'm having at the moment. I'm also tired, ashamed, insulted, belittled, feeling expendable. These are just some of the things I think when y'all ask us, how are you feeling? Particularly when we get surveys like we just got. I've been a member of the Henrico County community my entire life, first as a student, and then I chose to come back as a teacher. I've always been very proud of both of those things, but not today. Today I'm ashamed. I'm seeing my life, my colleagues' lives, being weighed against the inconvenience of a small yet loud portion of the parent population. And what's worse, I'm being them seen found wanting. Okay? Teachers have become the enemy. We're labeled lazy, apathetic to the needs of our students, and let me tell you, no one is more aware of those needs than we are. No one cares more than we do. No one could love your students the way we do. Teaching is a labor of love. That's why we're against a return to face-to-face instruction. I want those students safe. I want my colleagues safe. And you cannot look me in the eye and tell me at this time that any iteration of a hybrid plan is safe. I hate that we're being called selfish when safety is the root of our concerns. Teachers have been dealt a shorthand for years and accepted it because of the love we have for our students. Look, we actively practice standing between them and a bullet. And that doesn't scare me the way this does. Okay? This, believe me, I promise you, is the immediate threat. Returning face-to-face will not be like it was this time last year. It'll be bleak at best, disruptive or damaging at worst. But you know that. I'm not going to quote statistics at you. You know them. Virtual, despite its obstacles, is working for many of our students. Is it perfect? No, but neither is in person.
Thank you so much.
Just one more thing. I'm asking you to look beyond the pressure and the politics to make the safest, if unpopular, decision in this community.
Jeffrey Wooden. Okay, next, Michael Davey. Michael Davey, thank you. Davey, yes, sir. You may begin.
Thank you. Can y'all hear me okay? Members of the school board, my name is Jeffrey Wooten. I'm an English teacher at Freeman High here in Henrico County. I can't express to you the fact that every teacher that I know, every educator that I know wishes that we could safely be in the building with our students at this time. But unfortunately, we're just not in a place where we can do that. In August, when the school board decided that it wasn't safe for us to resume in-person learning at the start of the first quarter, Henrico County on August 17th, for example, had registered about 730 new cases of coronavirus in Henrico County. As of yesterday, Henrico County just registered 1,000 new cases. While this is happening, epidemiologists throughout the country are sounding the alarm and cautioning us that as the weather gets colder and people spend more time indoors, coronavirus cases are going to surge. And one even went so far as to say that it would be plausible for us to exceed 400,000 deaths by New Year's Day in this country. Members of the school board, if we're to resume in-person learning in a safe way, our plan needs to be airtight. Take Spain, for example, a country with about the same number of cases per county as Henrico County actually has. In different regions throughout Spain, students are to be no less than 5 feet away from one another at all times. They're grouped into small, like cohorts or bubbles, isolated from other students, where they travel from class to class. And if one student from that cohort gets sick, the entire cohort and everyone who came into contact with quarantines for 2 weeks. Unfortunately, Henrico's county plan isn't that stringent. Not only do we not have that type of bubble parameter available, Henrico's county plan stipulates that students should be 3 feet away from one another, quote, to the greatest extent possible. Members of the school board, we get one shot. We get one shot to do this right. As a country, we have about 4% of the world's population, but we have 1/5, 20% of the world's coronavirus cases and deaths.
Thank you so much. Thank you so much.
Once we are in a place where we have a plan that is strong enough to be safe, we can go back to in-person learning, but we need a plan that's stronger, not weaker
than
other nations, and right now we just don't have that.
Thank you so much. Tracy Brown, are you here? Thank you. You may begin.
Thank you. Members of the board.
Could you please speak to the mic? There are people watching that would love to hear you.
Okay. Can you hear me?
Yes, sir.
Members of the board, Dr. Cashwell, my name is Michael Davey, and I'm a social studies teacher at Vernon High School. I was going to come here and talk about plexiglass, enrollment dropping, loss of funding, airborne viruses, but I believe everybody in this room knows all about that. What I want to talk about is the community I teach in at Vernon High School. I've been at Vernon for 5 years, and I've gotten to know a number of the families in the community. Many of my students live with older family members who are more vulnerable to COVID. I've had multiple students tell me that they worry about their grandma getting sick. Many of my students live in homes where any form of social distancing is almost impossible due to available space and the size of their family. A student told me that their mother is pregnant, and their mother is very concerned about return to school because the student might bring back COVID and endanger the family, including the unborn child. I have several students right now who have COVID, and face-to-face school hasn't even started. A colleague's mother died of COVID-related complications last week. Another student told me 2 family members have died since spring. A number of my colleagues are single parents. One of them lost their spouse unexpectedly a few years ago, and they're raising their child on their own. What happens if that parent gets ill or dies? Should that child lose a second parent because we return to school when COVID numbers are higher now than they were in July? It's also my understanding the COVID infection rate is much higher in the East End where I teach than in other areas of Henrico. What does everyone think is going to happen if we return to face-to-face learning? I fear they will tear through their Verona community like wildfire. So as I stand here before you, I have a simple question. The board votes to return. If people get ill, they're disabled, folks die, what then? How will each of you feel knowing you sent students, staff, and the community as a whole back into danger? And will you believe it was still worth it? I don't think so, and I don't believe any of you do either. Thank you.
Kate Christner. Kate Christner. That mic back there, thank you so much. You may begin.
Yes. My family and I ask ourselves, why are we having this conversation? Why are we doing this in the middle of an active pandemic when clear scientific, statistical data and projections exhibit that there will be a surge of cases in the fall and winter months? Researching, we have found that many have their own agendas. We're not here to challenge anyone. Let's not focus on what we disagree on, but what do we agree? Our children are the treasures of Henrico. Look at the science. COVID is a very active, deadly disease with no cure. Within the last 2 weeks, COVID cases in U.S. children has jumped 13%. Even in our very own Henrico County, there's a surge and a spike of positivity that is not probably being mentioned about. One child can affect an entire household, pre-existing conditions or not. Why risk lives? Are you asking us not to be afraid? We hear the school board saying this and the parents saying that. We've seen videos and we've read articles of seeming like someone's trying to overthrow Henrico County school system. This speaks to fear. Why operate in a spirit of fear? Sending our children back to school during an active pandemic opens up a place for mistakes. This leads to possibilities. However big or small, why take the chance? This agenda should be about keeping everyone safe, children, teachers, staff, the community. The power of one vote. Today, November the 3rd determines if we live in an alternative reality or do we live in one that is real, full of red flags and loud bullhorns. Sadly, while in conversation with my son, he voiced, my husband voiced that you've already made a decision. You're going to send children back. My son said, Mom, why are you going to speak? I said, because the risk of doing nothing is way too big than the risk of just sitting here. It's going to school. Sadly, it's going to school during an active pandemic, risk catching COVID, and the caveat of all coming home with it, worth it. Is it that detrimental that you are willing to risk it? Pay the ultimate price, rushing to get children back in the classroom, no matter this alternative reality that everyone wants to live in. The truth remains.
Thank you so much.
In an active pandemic, science matters. Who among you are willing to vote yes to a possible death sentence to our children? You.
Kevin Edens, you may begin.
Hi, can you hear me?
Yes.
My name's Kate Christner, and I'm a mother of 3 boys, 2 of which that go to Tuckahoe Elementary School. I'm here, like so many others, advocating to the board to please vote choice. I would never ask anyone to go in person that is not comfortable. That's not on the table. I don't want you to go in person if you do not feel comfortable. But I do want choice. This is a worldwide pandemic. All over the world, schools are turning to their teachers and their administrators and the families to offer them choice to returning to in-person education. All over the United States, schools are turning to the families and the teachers and the admins to give them choice to returning into in-person education. All over Virginia, they are turning to the families, teachers, and administration. I'm just asking that the county of Henrico will consider giving us the choice too. Your survey shows that there's a want and a need for choice. There are teachers that want to come in, there are admin that want to come in, and there are families that want to come in. Again, we don't want people going in that can't. There's room here for something to work. Please consider choice. Thank you.
Thank you so much. Timothy Porter. That's right, I got it. Yep.
Just so you know, for a point of reference,
Yep.
Mr. Porter emailed earlier and was unable to come, but he has submitted his comments to be part of the minutes.
And you did share that with me, and I apologize for the oversight.
No problem.
Elizabeth Broder. You may begin.
Thank you. My name is Kevin Edens. I am a 15-year veteran teacher in Henrico County, as well as also have 3 elementary school kids in the Tuckahoe district. And I am here, I actually was not planning on being here 3 days ago, but after listening to the town hall and all the rhetoric and the fear that's been put out, I am advocating for my kids and for me as a teacher to be in person as a choice. So I am advocating for that. This is unsustainable, and I can tell you as a parent who has observed 3 kids at home, it is unsustainable. We can do better than this. Having a kindergartner stare at a computer for hours upon hours is not sustainable. So God bless our teachers at Tuckahoe Elementary. They are phenomenal. But it cannot and will not replace a in-class learning experience. Me as a teacher, some students are thriving in the virtual world, but there are some that are not. And I've already had 6 or 7 parent conferences virtually, and I keep hearing the same thing. I don't think this would be happening if this was face-to-face. And I can tell them, I don't think it would, because I've never seen the grades like they are this year in some of my classes with some of my students. So I'm encouraging you guys to look past what you've heard and give us options. That's all I'm asking for as a teacher and as a parent. Give us options. That's all I want from you. Thank you so much, and thank you guys for allowing me to come here and talk to you guys tonight.
Thank you. Julie Atlas. Is Julie Atlas present? Oh, that's you? Okay. I'm sorry. You may begin.
Greetings, everybody. My name is Elizabeth Broda. I'm a teacher and a coach at Henrico High School, social studies teacher, in fact. Thank you for the school board and the central office staff for coordinating this public forum. And thank you for making the initial decision to start the school year online. Your jobs are complex and demanding, especially in the challenge that we're currently facing, and your hard work does not go unnoticed. I, like many others, am reluctant to speak today, not because I lack the confidence in my position or arguments. I am reluctant to speak because as a social studies teacher, I'm trained to keep my political opinions to myself. I build political simulations for my students. I challenge them to think critically through political scenarios, both real and made up. Dr. Cooper, you've spoken to my class before at Henrico. I play devil's advocate to reveal cracks in student arguments. I ask difficult questions. I push students to see past boisterous and divisive political figures and instead focus on ideology and action. It is an incredibly rewarding job to have. But the more I thought about tonight's forum, the more I realized the topics being discussed are not political. Student safety on the bus, at lunch, while changing classes is not political. The safety of vulnerable student families, many of which living in multi-generational households, in dense apartments in our East End zone of Fairfield, is not political. Protecting our students isn't political. Protecting our teachers and staff isn't political. It's the practice of being in community. It's the practice of empathy and citizenship that we hope to instill in our students every day. Unfortunately, my brain ignored an important description of politics, though. Something becomes political when it deals with power relations between individuals, like the distribution of resources or status. And unfortunately, that's exactly what we're doing here. We're creating an inherently inequitable system where students and family access to resources will become even more dangerously divided than we already see it across the country.
Thank you
and
so
we are
much.
considering the creation of yet another faction, the in-school kids and the virtual kids.
Thank you so much, bro. Thank you. Thank you. Don Alexander. Is Don Alexander present? Don Alexander. Tasha Pitts, is Tasha Pitts present? If you'd be so kind, that microphone right there. Thank you so much. You may begin.
My name is Julie Atlas, and I work at Highland Springs Elementary School as a math coach. I have been an educator for over 15 years. One lesson that I have learned is that asking the right questions matter. The survey questions sent to employees were not asked in a way that allowed truth to be spoken, which is evident in over 260 pages of narrative that were written. The survey did not allow teachers to choose to stay home without either giving up their position or their pay. The only possible exception to this would be through the ADA accommodation, which I have been told by HR will not be allowed for remaining at home. Looking at going back to face-to-face instruction during COVID in any school is terrifying from a safety standpoint, as social distancing is not possible in most classrooms. Compound this with the lack of substitute teachers, old ventilation systems, eating in classrooms, lack of hot water and faucets that don't remain on without being held, we are setting ourselves up for failure. The data is clear. Black Americans are over 2 times as likely to die from COVID as their Caucasian counterparts. That describes most of my school's population, and our staff, our administration, our students, and our families. I have a master's degree focused on child and family trauma. According to the Holmes Rahe Stress Inventory, the most stressful thing that an adult or child can experience is the death of a close loved one. Death creates trauma. The number of employees in our county is approximately 6,600. If only 7% of our employees contract COVID, around 462 will become sick. If 4.5% of them die, there will be 21 deaths. So my question to this board today is, who are you going to choose to die? You already asked us to stand between our students and a bullet. You asked us to protect them in a hurricane, a tornado, a fire, from domestic violence, and from all other harm. You as a board cannot control those things, but you can control this situation.
Thank you so much. Thank you. Nancy Dole. Thank you. You may begin, Ms. Pitts.
Thank you for giving me the opportunity to speak. I am a retired nurse of 16 plus years in the state of New York. I am a retired educator of 10 years. I've had 4 children come through Henrico County Public Schools, as well as 3 grandchildren that are attending right now. And I wanted to come just to present this to you. I wanted to ask, whom amongst you is willing to have the bloodshed on your hands? We don't have time to make permanent decisions in a temporary situation. Right now, we're chartering waters that we have not charted before. It is unfair, it is unjust to ask our children to be a human shield, to send them out and to bring them back in, not knowing whether or not if they're contaminated. As a woman under authority and one that's in authority, I understand that sometimes we have to make decisions that won't make us popular, but we have to not look at what's going on in somebody else's backyard, what's going on in somebody else's county, and we have to look at the community that we're servicing. We have to look at the demographics and the people that we're servicing and see what the need is. We cannot do it based on what other people are doing. At the end of the day, would you be able to live with the fact that you sent a child out and sent them into a home and possibly wiped out a whole entire generation? Because we have multifaceted homes within this community. There's 3rd generation homes, 4th generation homes in this community. So I'm asking you, you're asking us to choose between education and life. I want to say that education doesn't happen in a vacuum. Education doesn't happen in a vacuum. Education doesn't happen in a vacuum. It affects everyone. It affects everyone. We need to be accountable and we need to be liable. At the end of the day, we have one person that we answer to, and that's our maker. Thank you.
Thank you. Terry Vernon. Thank you. You may begin.
Good evening, and thank you for this forum.
Could you step a little closer to the mic? Thank you. That's
My
okay.
name is Nancy Dole, and thank you for this forum. I am here as a private citizen. Yesterday, the CDC expanded their wording for what constitutes contact tracing for those who come into contact with a person who has tested positive for coronavirus. I will read to you a short excerpt from the Washington Post describing this. The change by the Center for Disease Control and Prevention is likely to have the biggest impact in schools, workplace, and other group settings where people in contact with others for longer amounts of time. It also underscores the importance of mask wearing to prevent spread of the virus. CDC has previously defined close contact as someone who spends at least 15 consecutive minutes within a 6 feet confirmed coronavirus case. The updated guidance, which health departments rely on to conduct tracing, now defines a close contact as someone who was within 6 feet as infected individual for a total of 15 minutes within a 24-hour period. With that said, under these guidelines, would you expect that individuals who test positive would be contact traced and those who were considered a close contact would be notified? This negates a situation that happened to a very good friend of mine just this past weekend, where they were in close contact for over 15 minutes with an infected individual and without a mask, but yet no contact tracing was done by the county. My question to the health committee and the board and Dr. Avila would be, if the county does not perform contact tracing under the old guidelines, how do you expect school leadership, how do you and school leadership expect to keep 65,000 students, staff, and their families, which could equal over 200,000, safe?
Thank you so
if
much.
you don't have the proper procedures in place?
Thank you so much.
Thank you.
Before you begin, Terry Vernon.
That's me.
Okay. Brett Daniel, if you could take that. Thank you. You may begin.
Okay, my name is Terry Vernon. I'm the Innovative Learning Coach at Verona High School, and I have a daughter at Seven Pines Elementary School. And I've wrestled with this as both a mom and an educator. But a choice for families doesn't give me a choice. I got the choice to keep my job and go in person or to not have my job. And there's a variety. I know I read all the details about the Family First Corona Relief, and I looked at all of the documents. I don't have a pre-existing health condition. I just don't want to get the virus. What about those people? And there's a huge amount of teachers that are also parents, and it's scary. And I just wanted to also say, the plan that was put together was so detail-oriented. You tried to think of every single possible situation. People don't follow rules. We can't even follow the rules here and stay within our time limit. How are everybody going to follow the rules? My daughter can keep her mask on. The kids who came in here, they're inspiring. They are not indicative of the average student in Henrico County Public Schools. They can't follow the dress code. They're not going to do this on a regular basis. And yes, I appreciate the fact that secondary was pushed off to the second semester in that kind of time frame. We don't need to do this with anybody right now. People have talked about the fact that cold and flu season is coming and all of this stuff. We are not any better off than we were when we stood here in July. We need to make the same decision now that we did then. I want to be back in my school with my kids. I want my daughter back in her school learning from her teachers. But we can't even get to that. This plan is not that. There's no small group instruction. There's no carpet time. You're 6 feet away from somebody. How can we socialize? We can't get back to the before times school. We're not there. We all want that. We don't want this other thing.
Thank
This
you
other
so
thing
much.
is not going to work.
Thank you so much.
My name is Brett Daniel. I'm a kindergartner at Tuckahoe Elementary. I also have a middle schooler in private school. Thanks for allowing this forum tonight. I think this comes down to three things. It's about truth, it's about choice, it's about equity. When we're talking about this, we're operating on two separate sets of facts. People are analogizing it to school shootings. They're talking about bloodshed. They're talking about the choice between education and life. If there was a chance my child would die, I would not send him to school. This is not about education versus life. This is about the truth. And the fact of the matter is, my middle schooler is going to school in person and thriving because schools have found a way to make it work. And we're asking this board to find a way to make it work as well. It's also about choice. If people don't want to send their children to school, you have the choice to remain virtual. Teachers, I understand that you're scared, but you are essential. Have you gone to the grocery store? Those people are working. They've been working for months. Have you gone to the liquor store? Because apparently alcohol is essential. You are essential. We value you. If you need to stay home, if you have a condition, you have the opportunity to file for an accommodation. You will have that choice. 75% of teachers said they were willing to return to school. Lastly, we need to talk about equity. People that can afford to send their kids to private school are. People that can afford a private tutor are getting private tutors. People that can afford pods are doing it. The children that can't do it are the ones that are falling behind, and they will never catch up. Time's running out. Please, give us the choice.
Thank you so much. That ends our public forum. Board members, you need 5 minutes, or can we push back on? Okay, I'm going to take a 5-minute recess. We'll return in 5 minutes.